Recently, GISB Holdings was reportedly involved in the sexual abuse of underage children. Abang Bas was also convicted for acting inappropriately on TikTok towards primary students, and a 15-year-old Orang Asli girl was raped by a man on their way to Kedah. In November 2023, the Court of Appeal upheld the 42-year jail sentence on a man who raped his underage stepdaughter 105 times over 3 years. Meanwhile, on 24 September this year, the Court of Appeal maintained a man's sentence of a 25-year jail term and 10 strokes of the rotan for raping his underage and mentally disabled daughter. In July this year, there was also distressing news on an 11-year-old girl who had been gang raped by 4 teenagers in Teluk Intan. These are among some of the many disturbing cases of child sexual abuse that are becoming more frequent over the years. Although we cannot oversee the fact that the government has made it mandatory to make a police report when witnessing a child being abused, which will also result in more cases being documented. Why are such cases becoming increasingly frequent? Is it due to issues in our country's legislative framework, case handling, legal procedures, or the lack of sex education and society's taboo on this issue? We spoke with the founder of the NGO Monsters Among Us, Faidzal, and the program director of Women's Centre for Change WCC Penang, Karen Lai, to get their views on the issue.
So, how we define child sexual abuse is when a person in power abuses that power to sexually gratify themselves by abusing the child, by coercing, manipulating, building the trust with the child to participate in sexual activities. Is always an issue of power and control. Um, so definitely, I think our society do not have enough understanding of what power dynamics is and how it impacts relationships.
Again, my general experience has been that even though not always perfect, our law and legal system does prioritize this issue and also the safety of children. But as I mentioned, abusers are constantly finding new ways to target children, including targeting them online. So it's important to consider what type of sentencing suits the gravity of the crime. Yeah, and when it comes to violation of children, I think we need to take a very hard stance on that. It's a very severe offense. And often there is also a relationship of grooming where the perpetrator manipulates the child into trusting them and also into not disclosing the abuse. So then it's difficult then to detect and to get the reporting out in the first place.
One of the most significant factors in curbing child sexual abuse is sex education, which can greatly help children identify potential threats, raise awareness, and guide them through various situations. However, is comprehensive sex education (CSE) in Malaysia adequately preparing children for such situations? Does it teach them practical preventive methods and help them navigate confusing emotions while fostering more mature thinking as they grow up? Women, Children and Community Development Parliamentary Select Committee Chairperson Behin had previously urged for improvements to the CSE syllabus currently being taught to children. Meanwhile, Fer also shared her concerns with us regarding the shortcomings of the syllabus.
Ramai di antara kanak-kanak ataupun ibu bapa belum tahu lagi having sex di bawah 16 walaupun consensual adalah satu kesalahan di bawah undang-undang Malaysia.
So when a person touches a child's shoulder and she or they become very uncomfortable, that itself becomes an unsafe touch. But we don't teach that. What we teach is there are private parts, you have to stop touching the private parts. But as we all know, sexual grooming starts by introducing physical touches because the perpetrator wants to blur the boundaries and blur the lines from physical, seemingly safe places to touch. And when the child is already familiar with physical touches, the physical touches develop into sexual touches, the child is already victimized because the child is already trusting this adult. So that's the conversation that we're not seeing in CSE. It is there, bits and pieces, but it's very isolated. They do not allow children to process whatever that they are learning.
According to the Health Ministry's National Health and Morbidity Survey 2022, 33% of respondents admitted to having sex before the age of 14. The survey revealed that regardless of society's reluctance to discuss sex, children are still taking part in the sexual activity. Malaysia's Comprehensive Sex Education CSE program, known as Pendidikan Kesihatan Reproductive dan Social Peers, is designed to educate children on this sensitive topic. It starts from ages 7 to 18 and is divided into 4 stages. However, the module is too broad and lacks depth. It covers topics such as safe touch skills, the reproductive system, sexual identity, teenage pregnancy, and more. In contrast, Singapore's syllabus clearly outlines that primary school students are taught about safety and safeguarding, including ways to protect themselves from sexual abuse both online and offline. They are also educated about their right to safety and how to seek help if they are sexually threatened or abused. On November 10, 2024, Minister of Education Fadlina cited data from the Health Ministry which recorded 44,263 cases of teenage pregnancies over the past 5 years. To address this issue, the government plans to incorporate the PEERS module into the 2027 school curriculum. While it is reassuring that the government is taking steps to tackle this problem, is the syllabus truly up to date with the needs of today's children? The module also suffers from a lack of professional monitoring as it heavily depends on individual teachers' personal views on the subject, making the teacher's role critical.
Even if there are subjects on contraceptive, how do you encourage the child to use this information in their daily lives? You cannot just list down condoms with control pills without them understanding how do this information play in their daily lives. Many studies have shown the more you teach children about CSE, the longer time they take to actually start becoming sexually active. Studies all around the world have shown, even when we do programs with children, they all say they don't want to have sex once they know the repercussions.
Where we fall short is this continuing discussion on whether sexuality education or comprehensive sexuality education is available in schools. It's not at this point in time, right? So that is still a lacking dimension of the support we have for our children in the education system at this stage. It still needs to go further is when it comes to adolescents and teenagers who are, I think, becoming sexually curious in their development. So experts have been urging the government for years to include comprehensive sexuality and reproductive health education in schools in the formal curriculum. And this would include conversations around respect, consent, and boundaries.
I wish there was a clear, black and white method to implement it. But when you talk about sex education, like I said, it really varies from the society, the readiness of the children, and also location. Because I think, the needs and demands for people in, say, for example, in Orang Asli villages may be different than family living in the cities. So this is where the challenge is. For example, governments, when you implement policies, you also need to sit down and think of the best ways and how it can benefit every single layer of our society. Men should also be brought into these discussions. When we talk about children's rights, families, it should not be just the women talking about it. I want to see more men talk about this. I want to hear their input, and I want to see our society mature in a way that when we talk about gender issues, families, and children, sex abuse and whatnot, it's more of a gender balance perspective.
Shalina also stressed that the government is moving forward with regulating the guidelines for childcare centres as there are many unregistered centres without checks and balances. Due to economic pressure, some working parents are forced to send their children to unregistered centres while they are at work. But is it really safe for them, especially when some centres don't have any regulations to follow? The Bukit Bendera MP expressed her concerns about this issue and assured that the Parliamentary Special Committee on Women, Children and Community Development is looking into the matter.
Economy definitely affects families, but it's also crucial to ensure that financial limitations it does not compromise the child's safety and growth. The responsibility is on us to ensure that quality childcare exists and more so affordable and accessible.
Beyond the government's efforts, what can we do as a society to address this issue? To this day, Malaysia remains very conservative on matters related to sex education, with societal taboos hindering open conversations with children. If we do not provide children with a safe space to express their confusion and fears, how can we guide them properly on reproductive health? How can we ensure they receive accurate information instead of relying on potentially harmful or misleading content from the internet? How can we improve our approach to this culturally sensitive topic? And how should we respond when faced with these unfortunate events?
As for victim blaming, well, yes, yeah, generally there tends to be, especially patriarchal assumptions, right? Assumptions that are quite misogynistic, quite anti-women and girls also. That women and girls should behave a certain way, dress a certain way, and if you behave a certain way or dress a certain way, then you're inviting sexual harassment or sexual assault and all that. So we definitely need to end this mindset. We need to have a focus on the offender's behavior, and we need to talk about the importance of men and boys behaving respectfully towards women and girls, and taking sexual harassment and sexual assault or sexual abuse as a serious matter. Nowadays, with wide resources available, including WCC's resources, for instance, but also a lot of other information on the internet, there's really no excuse for not reading up or understanding these issues better. I don't feel that you can't make a difference as an individual.
In 2020, MCMC reported that there were 20,989 cases of online child sexual abuse material recorded in the country. In today's digital age, the internet has become a platform for heinous activities such as live streaming child sexual abuse and grooming children for sexual exploitation. Offenders can commit these acts remotely, making it challenging to gather digital evidence and further endangering children's safety and privacy. Shockingly, it can take less than an hour for predators to target and manipulate young victims to get them to share intimate images or videos. Typically, offenders begin by befriending children, slowly building trust before applying pressure that can escalate into coercion or threats. They exploit children's ignorance and invade their privacy in deeply harmful ways. To stay safe, children and their caretakers must remain vigilant about privacy when using social media. Avoid sharing real-time locations or sensitive information. Always ask yourself, am I comfortable sharing this personal information with a stranger? If someone makes you feel uneasy or pressures you into uncomfortable actions, it's your right to refuse, disengage, and immediately report the situation to a trusted adult.
Principally, adults should learn to listen. This includes not just parents, like any adult out there who live or work with children. You need to learn how to listen. But operationally, I really believe the only way for you to address shame and judgments and biases towards sexuality is for you to actually make the extra effort to learn. Are you reading enough materials online to support you as a parent? Are you seeking support from the right people who are experts in the topic?
Social taboos that surround topics such as sex education. In our culture, we understand that these subjects are but often considered sensitive and also inappropriate, which also prevents essential information from reaching those who need it the most. This is a type of silence that can leave children unprepared to recognize or even report inappropriate behavior, and this increases their risk of becoming victims. We need to find ways to really reach out to our children and educate the children and parents. So yes, definitely, we have a lot of work that needs to be done, and it's a continuous work in progress. We've seen so many horrors on social media. We've seen so many exposés on all these, Telegram groups, objectifying school children, and it's just, we need to put an end to that.
Is Malaysia's law on child sexual abuse crimes adequate? According to Section 376 of the Penal Code, the punishment for raping a child under 16 years old includes imprisonment for a term of 10 to 30 years, along with whipping. By comparison, Singapore imposes a minimum prison term of 8 years and up to 20 years for the rape of a child under 14, along with at least 12 strokes of the cane. Karen, a representative from Penang, states that Malaysia's legal framework and procedures are stringent enough. However, critical questions remain. Are the authorities receiving adequate professional training to handle cases involving child victims? And how are investigations conducted to ensure the emotional well-being of these vulnerable individuals is protected?
while it is not a life sentence, the law views it as a comparatively serious offense. I think, however, that there is a challenge in that there's no direct evidence or data that shows that increased prison sentences will necessarily reduce crime rates. And I think the other important factor to remember is for sexual offenses against children, often the perpetrator is somebody that is well known to the child. A family member, oftentimes, sad to say. So if you raise the sentences very high in those situations, you have to also think about whether it also leads to the risk of underreporting and people wanting to keep it quiet because they don't want to get the offender into that kind of trouble, or because the offender is, the head of the family, the father or the breadwinner, and so forth.
In 2022, UNICEF published a report titled Disrupting Harm, which concluded that underage survivors often experience a whirlwind of emotions, which could include confusion, self-blame, shame, and guilt. These complex emotions leave children vulnerable and disoriented. To prevent re-traumatization, professionals such as police officers, judges, attorneys, lawyers, and doctors should receive specialized training on accurate procedures for interacting with survivors. Malaysia has recently passed an amendment to the Evidence of Child Witness Act (ECWA), improving the court hearing process for child victims. The amendment includes the provision of safe waiting rooms and a more child-friendly environment for testimonies. However, due to limitations in human resources, this is an area that still requires significant strengthening. Shalina shared her insight with us on this.
I think training should be a continuous process. It should be ongoing, because when we talk about training, say 10 years ago, it will definitely have some changes 10 years later on, 20 years. So again, going through constant, continuous training is a must. Some might say that they're overburdened, overwhelmed with a barrage of other issues and cases. Again, it boils down to resources, the human capital. But with that being said, like I said, there's always room for improving and enhancing trainings, especially when we talk about the investigating officers. But with that being said, we already have the system, we already have the ecosystem, we already have the resources. And again, in the committee, we've had several taklimats briefings with PDRM, and they have the statistics, they have the women officers who are very passionate in protecting the children.
In an encouraging development, Malaysia's NGOs are stepping up efforts to tackle sexual violence against women and children. Organizations like the All Women's Action Society, AWAM, have launched initiatives such as the Telenita Helpline, offering free online counseling services to those in need. Similarly, Monsters Among Us runs the My Body, My Rules program, which educates children nationwide about body safety in an open and supportive environment. The Women's Aid Organization WAO provides comprehensive support services, including a childcare center, refuge facilities, and a telephone hotline. Meanwhile, WCC Penang focuses on prevention by teaching children essential safety measures, training teachers and counselors on cyber safety, and equipping professionals in the criminal justice system with skills to handle victim instructions sensitively. WCC Penang also offers free educational resources on their website, such as online storybooks to raise public awareness. Karen emphasized that ensuring a safe and supportive environment for victims during legal proceedings is crucial. Not only does this improve conviction rates, but it also helps reduce cases that result in DNAA, discharge not amounting to acquittal.
Technically, on paper, these interventions are available, but due to resourcing such as not enough personnel or where equipment is lacking, for example, child interview center facilities or video live link facilities in court or child witness waiting rooms, then there is a gap in enforcement, and this has a direct impact on the child victim when she chooses to report and enter the justice system. I think WCC can say that from experience, that where all these measures are provided to victims, that it makes all the difference in whether they choose to stay on in the system and how calm and confident they are in giving their best evidence.
As responsible members of society, we should educate ourselves with more knowledge on child sexual abuse. We can also pressure our MPs to focus more on this issue during their parliamentary term, such as to improve our sex education syllabus, as it will help children identify crimes and protect themselves. Malaysia's social taboo is also one of the contributing factors to the escalation of this issue. Children's safety should not be overlooked, and it's a pressing matter that all of us should be concerned about. What do you think about this issue? Share your thoughts in the comments below and follow KiniTV for more stories like this. Scan the QR code on the screen to donate and support our work. I'm Soneeya Kalaiselvam. Thanks for watching.